Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to the Nourish MD's podcast. I'm one of your hosts, Lauren Papanos. I'm joined by my co-host, Romana Brennan. And today we are kicking off with a part 2 to the perimenopause, menopausal nutrition conversation. And we're going to be talking about some more natural treatment strategies that you can explore both within diet and supplementation. So we're going to talk about some of the common symptoms that women experience during these times, and then some of the common treatment approaches that we can explore within this. So if you haven't had a chance to listen to our first 2 episodes on this topic, we interviewed Dr. Masterman initially. He provided a lot of context around some of the changes that are happening during this time. And then in our follow-up episode, our first nutrition episode, we talked about some of the metabolic changes that happen and dove a little bit deeper into some of the hormonal changes and why those hormonal changes influence symptoms that occur. So definitely go back and listen to those. But Romana, why don't you kick things off and tell us a little bit about just some of the main symptoms that you see with patients?
Yeah, so one of those primary symptoms, whether you are postmenopausal or know someone who's postmenopausal, probably have heard about it a lot, is hot flashes. And hot flashes is one of the primary manifestations in which the nervous system is involved in this kind of time frame. Hot flashes, as well as uterine fibroids, actually. So when it comes to thinking about kind of treatment strategies for these, I've grouped these two together because something that can be very beneficial is actually phytoestrogens. So phytoestrogens are plant-based compounds that actually mimic estrogens, and they've gotten a pretty bad rep just in terms of some research that came out many moons ago about soy containing phytoestrogens and some potential negative consequences of consuming soy for breast cancer risk. But that research actually wasn't able to be reproduced, and that's one way that we can really establish research as being robust research is if it is reproducible. So again, that's how soy kind of got this bad rep in terms of breast cancer development, prevention, things of that sort, is because of the phytoestrogens. But phytoestrogens are widespread in other foods as well. Soy is not the only source of phytoestrogens. Also flax seeds, edamame, of course, being that whole food, soybean, organic tofu, chickpeas, other beans and legumes in addition to soy as well. But flax seeds really being a good source of some phytoestrogens. But in addition to the food sources, we also can utilize supplementations such as black cohosh extracts. Black cohosh is an herb that is also rich in these phytoestrogen compounds. And there has been research to show that black cohosh can actually help reduce symptoms of menopause, namely those hot flashes, as well as sleep disturbances if you're waking up in the middle of the night because of those hot flashes. There's additional evidence to show that black cohosh might actually also help alleviate some mental health symptoms that can arise because of menopause or within that postmenopausal time frame, anxiety, depression. More research is needed in this area. And then another research study in relation to black cohosh did show that it helped reduce the size of uterine fibroids, specifically in postmenopausal women. So a lot of good potential within the context of breast cancer risk. Again, how I was talking about breast cancer in this context of phytoestrogens, more research is needed in this area, although a majority of research does show that taking something like black cohosh does not affect breast cancer risk. If it is something that you maybe have more of a genetic predisposition to, you might just want a little bit more research before recommending that to you. But again, food sources are always our first go-to. So flax seeds are a very rich source of lignans, which that's that phytoestrogen compound within flax seeds. Really, that more tangible recommendation for flax seeds to incorporate those phytoestrogens would be about a quarter of a cup daily of freshly ground flax seeds. So we want to make sure that you're not just consuming a flaxseed meal, but really getting those whole flax seeds and then grinding them fresh, because those lignans are more so a fat-soluble compound and they can oxidize. So similar to how other fats or oils, we want to keep them out of the sun, keep them out of heat if you're not cooking them, because those fats can oxidize and essentially become rancid, reduce free radicals, things of that sort. At least lose those beneficial compounds. Similar can be said of lignans. So we want to make sure that those are freshly ground so that we can get as much of that active lignan as we can, as much of that active phytoestrogen power. So that's a little bit about phytoestrogens for hot flashes and fibroids. But Lauren, why don't we also discuss low libido, which is a very prevalent menopausal symptom, and those other symptoms of those low androgens.
Yeah, and low libido can be for a multitude of different reasons. So one common cause can be because there's low androgenic hormones, low testosterone levels that are happening. But sometimes that doesn't occur during menopause, and it could be because the body's in more of an activated nervous system state. We know that in menopause, the body is in more of a naturally activated nervous system state, which just means that you're more prone to being in like a high cortisol state or more of a sympathetic dominant type state where your body's more in fight or flight mode naturally. And when you're in fight or flight, libido is going to heavily diminish. And so that could be some other reasons to explain this. But if it is due to low testosterone, and that's something that's been validated from testing where your free testosterone is low or on the very low end of the range, then an herb that can be useful for this is tribulus. And tribulus has been shown to help improve testosterone levels, as have other vitamins like zinc and vitamin A. So we definitely want to make sure that we are getting enough of those food sources in the diet, and maybe even looking at like short-term supplementation of those if it's warranted, and then potentially exploring the use of tribulus if it's effective for you. We've seen it be effective for a lot of patients, but everyone has their own response to herbs. So it's really important to try something, give it a couple of months, and then, retest, kind of reassess symptoms to see if it's something that is helping to boost those testosterone levels. What are some other symptoms that you see commonly and treatment options for them, Ro?
Oftentimes we see a big shift in energy levels. So that could look like a couple different things. Maybe you're waking up feeling super groggy, not well rested, or just having difficulty waking up. Other times we see people being tired but wired in the evening, or having an afternoon crash. Again, hot flashes also tied into that too, just because of that nervous system activation. So similar to if you all tuned into our previous episode where Lauren was talking through the role of the adrenal glands and how that transition looks when the ovaries decrease production of these sex hormones, and we're really relying on the adrenal production of these hormones. And the adrenal glands are really key in our stress response. So our cortisol, that main stress hormone, is also produced in the adrenal glands. And so all around, we're asking a lot more of these small glands that sit on top of our kidneys, right? So we might need to implement something like adaptogenic herbs or nervine herbs, something to be implemented to really help support that nervous system, support that stress response, and essentially support your resiliency to stress. Maybe you're noticing, in addition to these energy levels, that you're more irritable throughout the day, or kind of those mood changes that also intersect with that stress response, or noticing I'm not as stressed, or at least from an external perspective, you think that you should be more resilient to the everyday stressors that are coming about in your life, but it doesn't take as long for things to set you off, things of that sort. A lot of intersection between mood and between those energy levels, just as cortisol levels are changing throughout the day. So naturally, what we like to see with cortisol levels, we want to have a robust waking, not too high of a waking response, but cortisol levels, once we're awake throughout the morning, are naturally going to increase. That natural increase is what helps stimulate our circadian rhythms, helps stimulate thyroid hormone production. And we want that around its lowest point before we go to bed to help stimulate melatonin production, help move us more in from that sympathetic to a parasympathetic state, that rest and digest state in which we are more ready for sleep and for rest. Oftentimes we can see this adrenal dysfunction where maybe cortisol levels are flat throughout the day, or maybe they are high upon waking, where we might be waking up feeling slightly more anxious. Maybe they're low in the morning time and then high in the evening time or the afternoon, where we might just want to pull down that adrenal response, pull down that cortisol production at certain times of the day. So because that fluctuates, we also want to make sure that we're producing cortisol according to this appropriate pattern. If not, that's when we might want to implement something like an adaptogen, which is going to overall help your body better adapt to stress responses throughout the day, or something like a Nervine that's more specifically going to support your nervous system. So adaptogens can either be calming or stimulating. We would use those in different contexts. Some stimulating adaptogens, for example, might be ginseng, licorice. As a caveat, you would not want to use licorice if you are dealing with hypertension. There can be some contraindication there. We also have our calming adaptogens, something like ashwagandha, holy basil, things of that sort, things that you can find in different forms as well. More often than not, we might want to use more so of a calming adaptogen in the evening time if you're feeling that kind of tired and wired effect. If you're having difficulty waking up or feeling groggy in the morning, not able to get those energy levels up in the morning, that's when we might want to use a stimulating adaptogen. But overall, again, adaptogens have more of this broad effect and help restore balance to our nervous system. Then again, depending on the type of adaptogen, they also support the immune system. Others help improve focus throughout the day. Overall, as a collective group, helping to better manage daily stressors. So different adaptogens can serve slightly different purposes. Versus Nervines, more specifically, help support the nervous system. Some are more calming. Other ones are more strong relaxants. So you might notice chamomile having a more mild effect than something like valerian root, passion flower. It can also help with muscle tension, wakefulness at night, things of that sort. So overall, really helping support and calm, relax your nervous system.
Yeah. And then I think inflammation is also another big area that women experience during this time period. And that could either be that we're seeing like an elevation in a marker on labs called C-reactive protein, or it could just be that you're having inflammatory symptoms like joint pain, bloating, water retention, difficulty losing weight, and even depression can be another symptom of inflammation as well. And part of that is because we know that menopause is a naturally pro-inflammatory state. So you're kind of, as we mentioned, like the body being in a nervous system activated state, your body being more prone to that sympathetic dominance where you're in a high cortisol state chronically. Your body's also more in a low grade inflammatory state. So we just see higher levels of inflammation at a resting level. And there's some options within this that we can explore. I mean, definitely kind of first starting with dietary changes that can help shift this inflammatory response, and maybe lifestyle strategies like sleep and exercise that can also help with this too. Nervous system function is also a big piece of this, which you just talked about, Romana, with adaptogens and Nervines. What are some of the other supplemental things that we can do on top of some of those dietary and lifestyle changes for this low grade level of inflammation?
Yeah, absolutely. And I know that we chatted about this in a previous episode as well, just the role of omega-3 fatty acids. So omega-3s have a really impactful role on inflammatory processes in the body. There's actually a specific compound within omega-3s. They're called specialized pro-resolving mediators, also referred to as SPMs. These compounds, especially for women during menopause, these types of compounds have been shown to have really good efficacy in addition to omega-3s. So can be supplemented with them. Of course, omega-3s can be found in the diet, fatty fish, salmon, mackerel, things of that sort, sardines as well, in addition to, our flax seeds, chia seeds, walnuts, things of that sort, also good sources of omega-3s. Both these SPMs and omega-3s, specifically SPMs as that more active compound, they can actually help inhibit the inflammatory response that happens. Again, you had mentioned how within menopause, we are really in this kind of heightened inflammatory state, this pro-inflammatory state. So if we can actively implement these compounds that help decrease those inflammatory signals, that can be very impactful. So they work by doing that. And then they also help essentially clean up cellular debris that would be from those damaged tissues. Once the immune system is triggered, it's a little bit different when we're talking about more acute inflammation versus more chronic or systemic inflammation. But essentially, these compounds can help kind of clean up that damaged tissue and also enhance tissue regeneration. If you have any pain associated with this type of inflammation, depending on where it's manifesting in your body, these have also been shown to help with pain reduction as well.
And I think outside of just that inflammation, which sometimes inflammation can show up here too, but we often see women experiencing like more frequent UTIs, urinary tract infections, or vaginal infections like bacterial vaginosis and yeast infections. And these can actually be due to this hormonal change that occurs, especially due to the low estrogen state that we talked about happening primarily really kind of at the later stages of perimenopause, but then definitely postmenopausally once you haven't had a period for at least a year, and when that FSH is high and that estrogen is low. And so estrogen is really helpful for helping lubricate vaginal tissue. It also helps with vaginal tonicity and helping with blood flow in the vaginal area as well. And that's one of the reasons why vaginal atrophy can occur during this time period of your life. And so because of all those reasons, that changes the pH of the vaginal microbiome. And so your microbiome is really this balance of bacteria in that area. And so we see that there are some pH changes that naturally occur that can predispose you to more vaginal infection type issues. And one helpful treatment option for this is using lactobacillus probiotics, in particular a strain of lactobacillus called Lactobacillus rhamnosus and Lactobacillus reuteri that have been studied for helping increase lactobacillus species. And that could be something you take orally as a probiotic supplement that actually kind of helps inoculate your gut and the vaginal microbiome with lactobacillus. And then you can also look at exploring using vaginal suppositories that are made from lactobacillus so that you can get a more localized exposure to that lactobacillus to really inoculate that vaginal microbiome and really shift that pH into more of an acidic environment. D-mannose is also another supplement. You've probably heard of the use of cranberry for UTIs before. D-mannose is an extract of cranberry that can be supplemented. We don't really recommend cranberry juice with UTIs just because UTIs can be also driven by blood sugar dysregulation, and cranberry juice tends to be really high in sugar. So it can be implemented safely in some situations, depending on how you're consuming it, how much you're consuming, but a safer option for individuals that maybe already are dealing with blood sugar dysregulation is using something like D-mannose. And all of these supplements that we're talking about, whether it's herbs or vitamins and things, can all be something that you look into and purchase through our Full Script dispensary, which is our third-party supplement dispensary where we dispense professional grade supplements. They've all been third-party tested, and they're all at the clinical dosages that has been supported in the research to provide efficacy for improving all of these functions. And so whether you're a PPMA patient or not, you have access to that. We're going to include the link to that below. And then if you are a PPMA patient and you want to schedule an individual nutritional consultation with Romana, then she can actually provide you with like the exact timing and brand and dosage of what would be the most valuable for you in each of these areas that we're talking about within the supplementation. Outside of that, we also look at low bone mineral density being a common symptom that occurs during this time period. And that's in part due to the drop in hormones, again, primarily due to the low estrogen state. It's been shown in the research that supplementing with minerals like calcium and such, once estrogen has dropped off in menopause, doesn't really move the needle very much on preventing bone stress injuries and bone fractures and osteoporosis and such. So if you are in perimenopause or even before perimenopause, we really recommend starting on minerals or implementing enough minerals in your diet before you get into a low estrogen state, because that's what's going to help to be able to mineralize your bone so that once those estrogen levels drop off, you're not more prone to these bone stress problems. However, if you've already gone through menopause, it is a good idea to still make sure that you have supplementation in this area. But we do want to make sure that it's not just calcium itself, that we also have its counterparts, vitamin D and vitamin K2, because those are what communicate with the cells, our osteoblasts, to actually get that calcium into the bone so that it's not hanging out in our bloodstream. So we want to make sure that not just vitamin D alongside calcium, but also vitamin K2, because that K2 is really that communication that tells the calcium to go into the bone. Outside of that, there's other minerals that are really valuable to the bone. It's not just calcium. It's like strontium and phosphorus and zinc and such that we want to make sure that you are getting in adequately, that we're getting enough protein, that we're getting enough collagen, because collagen is important for our bone matrix and helping us to be able to build bone. So making sure that you are meeting your protein needs, that we're stressing your bone by doing some resistance training every day or a couple times per week is another really great support tool. And that we also are eating and supplementing with adequate minerals like calcium, magnesium, zinc, and also vitamins like vitamin D and K2. One of our favorite options in this category is called Algae Cal. It's been very helpful for a lot of women, even that have gone through menopause and are in a lower estrogen state, to help kind of support this bone mineral density. And that's something that can also be purchased on Fullscript. Another good brand in this area, or another good option, is called Osteoforce. And that's another blend that has a lot of these minerals and vitamins in it, just depending on what you're looking for in this area.
Yeah. And then just to round out this conversation, kind of wrap up with, again, I had already mentioned, some sleep challenges, maybe sleep disturbances that you might be experiencing, whether that's from hot flashes, whether that's from feeling tired and wired before going to bed, whether it is difficulty staying asleep or difficulty falling asleep. These are all very common challenges as well that we see. So even beyond supplementation, maybe it's also just a matter of really establishing that circadian rhythm support, and from more of a lifestyle perspective and from even more of a nutritional perspective, addressing the root cause of these sleep disturbances. So when it comes to circadian rhythm support, sticking to a regular sleep schedule is really important. And the research has shown that if you can stick to within a 1 hour waking window, for example, so maybe during the week you wake up at 7, and on the weekend sleeping in would look like waking up at 8 o'clock as opposed to waking up at 9 or 10. So really staying within that 1 hour window has been shown to be very effective. And the same goes for falling asleep too, right? We want to make sure that we can build out that routine to help support your body to know roughly what time we want to start producing melatonin. We can also help nourish melatonin production by modulating our sunlight as well as any kind of blue light exposure. So if you can get sunlight in the morning, that's helpful to have that visual stimulus, that visual trigger to your brain that, it's time to essentially start that 12-hour clock in regulating your circadian rhythm. So just as much energy we can put into the beginning of our day, we can put into the later portion of our day, and we can really help support circadian rhythms on both bookends of our day. So in the morning time, making sure that we have that regular waking time, making sure that we get sunlight in the morning. Also, eating in the morning can help regulate your circadian rhythm, and which can help with thyroid hormone production, which can help metabolism. And we've already talked about the importance of metabolism and how those metabolic changes can occur throughout this menopausal period. And then on the later end of the day, making sure that we are implementing mindfulness strategies, being mindful of our screen time, utilizing blue light glasses if you are on screens later on in the day or essentially after the sun goes down. We want to really monitor that blue light exposure, and also being mindful of what you're consuming when you're going to bed or in that hour or so before you go to bed. Are you on your phone? Are you watching the news? Are you watching a TV show, etc.? So more from this lifestyle perspective, just assessing what factors might be influencing those sleep difficulties. And then blood sugar support, we've already honed in on the importance of that in the previous episode and in other episodes, but hypoglycemia, or those low blood sugar levels, can certainly contribute to nervous system dysregulation and can actually cause those waking up times in the middle of the night. So making sure that blood sugar is balanced can actually very much influence sleep and really make some significant improvements. So thank you so much for tuning in, everyone, to another episode of Nourish MDs. Again, I'm one of your hosts, Romana, joined by Lauren today, and we are so excited to be chatting with you about a brand new topic next month. So be sure to tune in 2 weeks and join us there.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.